Hello guys, and welcome back to my YouTube channel. In today's video, I'll be doing another journal presentation, and today's journal is titled The Genomic Landscape of Intrinsic and Acquired Resistance to Cyclin-Dependent Kinase 4/6 Inhibitors in Patients with Hormone Receptor-Positive Metastatic Breast Cancer. And as I mentioned in my last video regarding hormonal therapies, which you guys can check out right over there, I am going to talk. This paper is pretty much trying to find a solution to and for the patients that get a resistance to a CDK4/6 inhibitor, also known as like the Abemaciclib or the Palbociclib, and trying to find specific genes or pathways or other inhibitors that could potentially cause the cancer cells to die if there is a resistance to the CDK4/6 inhibitors. So I hope you guys enjoy my video today, and I hope you guys will be able to learn a lot from today's video as well. So please enjoy.
The first figure is a genomic landscape of the intrinsic and acquired CDK4/6 inhibitor resistance. And in this figure, as you can see, the researchers separated this whole into a sensitive group, intrinsic resistance group, and acquired resistance group. And after the researchers completed a whole exome sequencing, also known as WES, on 59 biopsies, they found that there were numbers of genomic alterations in genes that were known to be related to the hormonal positive breast cancer, as well as additional cancer genes and potential resistance mediators. And in figure 1D, the researchers did a bar plot visualization of the mutational and or copy number alterations in the select genes. And the blue means for the sensitive group, which means that there is no CDK4/6 inhibitor resistance in that specific breast cancer. And the different shades of red indicate the different types of CDK4/6 inhibitor resistance, or the intrinsic and acquired resistance. And before we go on, I will explain each of the select genes in a little bit more detail. For RB1, what we need to know is that this RB is a tumor suppressor. So what happens is that the CDK4/6 will bind with cyclin D, and these are all a part of the S phase of the cell cycle. And what happens during this S phase is DNA synthesis, where replication, transcription, and translation happen so that the cell can continue to be created and made. So then when the CDK4/6 and cyclin D is working regularly, and the RB1 will be hypophosphorylated, and this hypophosphorylation of RB will cause it to bind to E2F, also known as the elongation factor. And by binding with E2F, E2F will not be allowed to go to a promoter for the transcription, which will then block off the transcription from happening, which is technically in the end blocking the cell formation and growth from happening. However, if RB does not do its function correctly, such as being hyperphosphorylated or dephosphorylated, then this RB will not be able to bind to the elongation factor, and then the E2F or the elongation factor will bind to the transcription promoter, and then transcription will be allowed, which means that the cell growth and cell formation will continue, which is not what we want for cancer cells. Next up is the AKT gene. And the AKT is actually a very well-known oncogene. And an oncogene, if you don't remember from one of my previous videos, means that it is a cancer-causing gene. Therefore, this AKT pathway is related to cell proliferation, differentiation, and survival. The third gene that I'll be talking about is the ROS or RAS. And as you can see in the pathway photo, ROS can cause the oncogenic transcription, cell survival, cell growth and metabolism, and cell motility and migration. However, in most papers, ROS is most likely linked to the ROS-MEK-ERK pathway, which causes the cell cycle progression. Next, we have the Aurora A gene, and this photo is actually kind of pretty self-explanatory. The Aurora A will become overexpressed due to a mutation or some problem, and this Aurora A overexpression will lead to things such as the upregulation of the AKT pathway, loss of P53, or the failure of cytokinesis, and etc. But the most commonly associated Aurora A overexpression problem is genomic instability, and all of these problems will later lead to cancer. And therefore, Aurora A has a role in tumor progression. And it is also found in the spindle poles in mitosis. Next up, we have the CCNE2, also known as cyclin E2. And as shown in this photo, CCNE2 by itself is related to the G1S transition, which means that it is related to a cell cycle progression. Next, we have the FGFR2, and this in a longer form stands for fibroblast growth factor receptor 2. And what happens is that the fibroblast growth factor will attach to these fibroblast growth factor receptors, and then they will go through a change and then be phosphorylated, which will then cause other genes to kind of bind to this and lead to other signaling pathways, such as the ROS pathway, which is related to cell growth and death. Finally, we have our ERBB2, also known as the HER2. And what this one is that it pretty much binds to a growth factor receptor. And once it binds to the growth factor receptor, it could lead to the PI3K or the ROS pathways, which is then related to cell proliferation, survival, invasion, and metastasis. So next is figure 2, and figure 2 shows 7 different patients, and it also shows the different genes that were bound during each step of their treatments. And as you can see, these patients all showed the CDK4/6 inhibitor resistance. Figure 3 is called Clinical Vignettes for Candidate Resistance Drivers in Representative Patients. And among the representative patients, it included the 4 instances of biallelic RB1 disruption in Figure 3A, 3 patients with an activation of AKT1 in Figure 3B, and 3 with a ROS activation in 3C, and finally 3 with a high amplification of CCNE2 in Figure 3D. Figure 4 showed that the downregulation of RB1 or the overexpression of AKT1, Aurora A, and CCNE2 and ROS were all shown to be more resistant to the Palbociclib and Abemaciclib, which are the CDK4/6 inhibitors, compared to the normal and regular T47D or the hormonal positive breast cancer cell line. In figure 5, as you can see in 5B to C, in figure 5B, the researchers pretty much made a resistant cell line or a breast cancer cell line that is already like resistant to the CDK4/6 inhibitor, and in this case just the abemaciclib. And then they added each individual inhibitors. So from the top, we have the Aurora A inhibitor, then we have the ERK inhibitor, then we have the Aurora A inhibitor once again, and then we have the CHEK1 inhibitor. And in figure 5C, when after these inhibitors were added, the resistant cell lines for the abemaciclib resistant cell lines and the palbociclib resistant cell line all showed that there was a significant decrease in cell viability, which meant that the cancer cells had died after the inhibitors were added. So this is the final figure, and this is also like figure 6. So in the first part of the figure 6, one can see that this shows an actual patient and how she went on with her cancer therapies. And the end, which is the orange arrow, is actually an Aurora inhibitor. And this is actually just a trial, so it's not like been like completely used yet. So they're trying to see how she will be doing. But it says that the Aurora A inhibitor demonstrated a therapeutic efficacy in patient with the metastatic hormonal positive breast cancer after receiving the CDK4/6 inhibitors. And it also shows that there were high levels of RB1 and Ki67 values right before the patient was put on the Aurora A inhibitor. Then finally, in the last part of figure 6, each of the genes that were mentioned beforehand can be seen to be linked to some sort of pathway and were shown to be effective with a certain inhibitor. So for instance, RB1 and Aurora A were in the Aurora A pathway and were also like known to work with the inhibitors of Aurora A. ERB2 and FGFR2 and ROS were all linked to the MAPK pathway. And then the AKT1 was related to the AKT-mTOR pathway, while CCNE2 was related to the CCNE and CHEK1 pathway.
For the discussion of this paper, the researchers were able to find 7 main genes that were somehow connected to the CDK4 inhibitor resistance in hormonal positive breast cancer. And furthermore, the researchers were able to find through a clinical trial and through an experiment that the Aurora A inhibitor could be a potential solution to the problem of the CDK4/6 inhibitor resistance. And although this may not currently be used in the current society regarding the therapies and treatments, I hope that one day these inhibitors will become a part of a therapy that the patients can use in order to completely be cancer-free. So thank you everyone for watching this video, and I hope that by me kind of explaining what this paper meant and what each figure meant, that you guys would have been able to learn something new, and maybe for some of you guys like piqued an interest in researching about breast cancer. So have a good day, and again, thank you for watching.